Okay. Evidence-based therapy is a therapeutic approach that has actually had clinical research trials run. So if you ever see evidence-based practice, what that means is that the treatment has been provided often against what's called a control group. So you have treatment as usual, and then you have people who receive the therapy model that's in question. So maybe like cognitive behavioral therapy, that's one that's often talked about as being evidence-based. So you'd have people who don't get cognitive behavioral therapy versus people who do get cognitive behavioral therapy, and then there are outcomes that show that cognitive behavioral therapy may be a more effective treatment option. So it just means that there's research to back how effective that treatment is. Now, I will say that that's talking about the treatment itself, not the therapist that you're seeing. So you could have a therapist provide evidence-based treatment, but the therapist may not be very good at it or trained in it, and that means it won't necessarily work. You could also have good therapists who don't practice evidence-based treatment that are great. So just because something's evidence-based doesn't mean it's necessarily going to work well for you, but it does mean that there's a bit of research behind it. Emotionally focused therapy is another example of evidence-based treatment.